Hi guys, it's me, Professor D, and welcome back to my channel. On this video, I'm going to be covering schizophrenia and other psychotic disorders. If you haven't watched any of my videos, this is your first time, I tend to go pretty quickly when I go over these questions or even the explanations. So if you feel like I'm going too fast, don't hesitate, just press that pause button and you resume whenever you're ready. Please guys, don't forget, you know what I'm about to say next. Do not forget to do what? To like and subscribe below, and of course to press that red notification button. So guys, without any further ado, let's get started. First question. A paranoid client presents with bizarre behaviors, you guys know I can't pronounce, neologisms, and thought insertion. Which nursing action should be prioritized to maintain this client's safety? A, assess for medication noncompliance. B, note escalating behaviors and intervene immediately. C, interpret attempts at communication. D, assess triggers for bizarre and inappropriate behaviors. And I'll give you a moment to think of your answer. So the correct answer, guys, is B, note escalating behaviors and intervene immediately. That is very important as far as safety is concerned. What are escalating behaviors? Such as seeing the patient pacing. They're pacing back and forth. They're building themselves up for something, right? Or you see the patient doing this. Or even that look I just had on my face, right? All of those are escalating behaviors, and those are symptoms to let you know that things are about to go left, right? So you have to intervene before the patient harms themselves or somebody else. Now, choices A, C, and D, yes, these are important for safety, but they are not as a priority as B is. Watching out for those escalating behaviors and making sure you get to that patient before they harm themselves or anyone else. Next question. A client diagnosed with schizoaffective disorder is admitted for social skills training. Which information should be included in the nurse's teaching? A, side effects of medications. Guys, give me a second. I feel like my camera's sideways. All right, that's better. Okay. A, the side effects of medications. B, deep breathing techniques to decrease stress. C, how to make eye contact when communicating. Or D, how to be a leader. And I'll give you a second to think of your answer. And so the correct answer, guys, is C, how to make eye contact when communicating. Now, if you go back to the question, look what that patient's admitted for. Social skills training. So that's why C is our answer. So here's what they try to do to trick you guys. They give you really good answers, but if you watch, which video was that I did? I think it was the video on 11 tips to pass NCLEX. I talked to you about how one of the tricks that these test writers use, and I know this because I used to be one of them, right? They'll give you a beautiful answer, a correct answer, but it's not the correct answer to your question. So you always have to go to your question before you choose that answer and say, is this answering the question that's being given? So you have A, side effects of medications. That's a good thing. You want to teach patients that. You have B, deep breathing techniques to decrease stress. That's wonderful. D, how to be a leader. Great. But none of those teach the patients social skills, right? Except for C, how to make eye contact when communicating. Don't look down. Don't have a scowl on your face. You know, have an open demeanor where your arms and your hands are open and not like this, where it's closed, meaning you don't want to hear anything that patient has to, you don't want to hear anything the other person has to say. So C is the only one that answers the questions about social skills training. A client's diagnosed with schizophrenia tells a nurse, the Schizophrenians took my shoes out of my room last night. Which is an appropriate charting entry to describe the client's statement? A, the client's experiencing command hallucinations. B, the client is expressing neologism. C, the client is experiencing a paranoid delusion. Or D, the client is verbalizing a word salad. And the correct answer, guys, is B, the client is expressing neologism. Neo means new, logism is a word, so the patient's making up a word that doesn't exist, right? Go back to the question. Schizophrenians, is that a real word? No, okay? So words that don't make sense, they're just making it up. That's what it is, a neologism. Now let's look at our other choices because I want you to know why the other choices are wrong. You have A, the client is experiencing command hallucinations. Let me tell you what command hallucinations are, if you didn't know. Command hallucinations are those voices in the patient's head telling them to do something. And let me tell you something about command hallucinations. Those are the most dangerous types of hallucinations. You want to know why? Because whatever those voices are telling the patient to do, that patient feels absolutely compelled to do it. They feel that they absolutely must listen to those voices. So if that voice tells that patient to punch Professor D in the nose while Professor D is talking to the patient's going to go boop and punch me in the nose because they feel compelled to do it. So we do not play with command hallucinations. When the patient's telling you that the voices in their head is telling them to kill their wife or to kill themselves, guess what? That patient's going on watch immediately because they will feel compelled to do whatever those voices are telling them to do. And in this situation, that's not what the patient's experiencing. Choice C, the client is experiencing a paranoid delusion. Okay, so a paranoid delusion, first of all, guys, a delusion is having a belief that's not true, having a belief that's not real, right? So this is not the case at all. What this patient is doing is making up words, okay? So a paranoid delusion would be that the FBI is after me because they want to cut out my brain and use me as a science something, whatever, right? That's a paranoid delusion. That's having a false belief, okay? And that example was persecution. So that's wrong. Then you have choice D, the client's verbalizing a word salad. That is when the patient's using a whole bunch of words together in a sentence that make absolutely no sense. So they'll say to the patient, the doghouse under tree pig. What kind of sentence is that? Does that make any sense? No. So the patient's using a whole bunch of words together, trying to string a sentence, but it makes no sense whatsoever. So for this question, the correct answer is B. The client's experiencing a neologism, right? They're making up a word that does not even exist. A client diagnosed with schizophrenia tells the nurse, "Can't you hear them? It's the devil. He's telling me I'm going to hell." What is the most appropriate nursing response? A, did you take your medication this morning? B, you're not going to hell. You're a good person. C, I'm sure the voices sound scary, but the devil is not talking to you. This is part of your illness. And then D, the devil only talks to people who are receptive to his influence. All right, guys, so let's talk about this. The correct answer is C, I'm sure the voices sound scary, but the devil's not talking to you. This is part of your illness. This is the most therapeutic response because you're doing two things here. Number one, you're acknowledging their feelings, right? Their fear, their anxiety, you're acknowledging it. But number two, you're bringing them back to reality. You're telling them, I know this may seem scary to you, but it's not real. This is part of your illness. Right? You're bringing them back to reality, reminding them that they do have an illness. This is a mental illness. So you're doing two things at once. Now let's talk about the wrong answer choices. A, did you take your medicine this morning? That's not therapeutic, and that's just a yes or no. Okay? Do we like asking closed-ended questions? No. What are the three situations where we want to ask closed-ended questions? Suicide, abuse, and assessment, but when you need a quick assessment, like the patient's being rushed off to the OR, you're running with the gurney with the patient and you're saying, are you on any blood thinner medications? Do you have any allergies? Something like that. Those are the three situations where you want to ask closed-ended questions, yes, no. Other than that, you want the patient to express themselves, so you're going to ask open-ended questions if you're going to ask questions. So that's wrong. We're going to throw that out. Then you have choice B. You're not going to hell. You're a good person. You want to know what you did if you chose choice B? You gave validity to the patient's illness, them saying that they heard voices, right? You didn't even tell them that these voices are not real. This is part of your disease process. You are giving validity to what they're saying. You're saying, yep, those voices are real, but I don't think you're going to hell. No! You have to let them know that this is not real. You have to bring them back to reality. So that's wrong. And then you have... I literally can't even. Look at choice D. The devil only talks to people who are receptive to his influence. Absolutely not. You don't say that to the patient as a nurse. You do not give validity to that patient's disease process and what they're hearing. No. You acknowledge their feelings and you bring them back to reality. That's your job. C is the correct answer. Which nursing intervention would be most appropriate when caring for an acutely agitated client diagnosed with paranoid schizophrenia? A, provide neon lights and soft music. B, maintain continual eye contact throughout the interview. C, use therapeutic touch to increase trust and rapport. D, provide personal space to respect the client's boundaries. You better do D. You better. So guys, let's go back to the question and you'll see they tell you that the patient is acutely agitated. What does that mean? Right now. They're agitated right now. So look at choice A. Neon lights. Excuse me, when patients are acutely agitated, they need decreased stimulation, not more stimulation. Why would we give them neon lights? Why would we give music, even if the music is soft? They are agitated. We're going to decrease the stimulation such as sound and light. So that's wrong. Okay? Let's look at our other choices. B, maintain continual eye contact throughout the interview. So you have a client that is severely agitated and you're talking to them, and the whole time you're talking to them, you're like this the whole time. You want to know what that means to the client? You want to know how you come across? You're challenging them. And you better be ready for that client to swing on you. No. They are acutely agitated. Okay? Just like when you're speaking with someone, the regular eye contact, you keep the same thing. Okay? And let me tell you, when that patient's acute, and actually that's the first point I want to make about that. They're acutely agitated, right? You want to know the second point I want to make to you? When they're acutely agitated, you better not be staring at them like the whole time. You better be looking around. You're talking to the patient. You're looking at your exit. You're looking to see where that patient's arms are. Do they have something behind? Are they holding their hands behind their back? Because they might have a knife or a rock or something hit you with, right? So you better be looking at their body posture. You better be looking where their hands are. You better be looking for exits. You better be looking for nurses or anybody that you have around. You better be looking to see where your other patients are because you have to maintain their safety. Okay, all right. So anyway, wrong answer. C. I can't even. So they're telling you that this patient is acutely agitated and you're going to touch them? Are you crazy? Absolutely not. And look how they try to trick you. They said therapeutic touch. Not for this type of patient. No, you won't. They will swing on you. They are acutely agitated. What you're going to do is D. You're going to provide personal space to respect their boundaries. Why? You don't want them to feel threatened. You're not going to get into their personal space. You're going to be talking to them normally, but you're looking, you're assessing, because you have to protect the patient, you have to protect yourself, and you have to protect everyone else that's around. Okay? So that is the correct answer. Which nursing behavior will enhance the establishment of a trusting relationship with a client diagnosed with schizophrenia? A, establishing personal contact with family members. B, being reliable, honest, and consistent during interactions. C, sharing limited personal information. D, sitting close to the client to establish rapport. All right, guys, so the correct answer is B, being reliable, honest, and consistent during interactions. Remember, go back to the question, and in the question they tell you that the patient has schizophrenia. And something we know about patients with schizophrenia, remember, they have hallucinations. They have delusions, okay? And oftentimes they tend to be what? Paranoid. So it's not easy for them to trust. And in order for you to have a therapeutic relationship, you have to build trust. How are you going to build trust? You have to be consistent. If you tell that patient, I'll be back in 5 minutes, make sure you're back in 5 minutes. Even if it's to tell the patient, I'm doing something, it's going to take longer, but I'll be back XYZ, and make sure you keep your word, okay? Now let's talk about the wrong answer choices. We have A, establishing personal contact with family members. You want to know what that's going to do? That's going to make the patient feel that you and his family's plotting against them or her. All right? And it's unprofessional. Okay? Look what it says. It says personal contact. No. So that's wrong. Then you have choice C, sharing limited personal information. No. That's not going to establish a trusting relationship. Then choice D, sitting close to the client. No, they're going to see you as a threat. Do not get into their personal space. The correct answer is B, be reliable, be honest, and be consistent. That's how you build trust with your patient. A client diagnosed with paranoid schizophrenia states, my psychiatrist is out to get me. I'm sad that the voice is telling me to stop him. What symptom is the client exhibiting, and what is the nurse's legal responsibility related to the symptom? A, magical thinking, administer an antipsychotic medication. B, persecutory delusions, orient the client to reality. C, command hallucinations, warn the psychiatrist. Or D, altered thought process, call an emergency treatment team meeting. And the correct answer, guys, is C, command hallucinations, warn the psychiatrist. Now, we're not violating any HIPAA laws because guess what? The psychiatrist is the patient's doctor, okay? And remember, what did I tell you about command hallucinations? Those are the worst. Those are the most dangerous type of hallucinations a patient can have, right? So number one, you have to let the psychiatrist know, because remember, the psychiatrist is the doctor that's treating the patient for the mental illness. They're the ones that's giving the patient medications. That's number one. And number two, you have to warn them so they can be careful for their safety, because remember, when it comes to command hallucinations, the patient feels compelled to do whatever the voices are telling them to do. Go back to the question and you'll see it says, I'm sad that the voice is telling me to stop him. What that patient's saying is, I'm sad that I'm going to have to hurt this person. I'm going to have to hurt the doctor because I have no choices. The voices are telling me to do it. I'm going to have to do it, and I'm very sad about it. All right, so that is the correct answer. Which statement should indicate to a nurse that an individual is experiencing a delusion? A, there's an alien growing in my liver. B, I see my dead husband everywhere I go. C, the IRS may audit my taxes. D, I'm not going to eat my food. It smells like brimstone. And the correct answer, guys, is A, there's an alien growing in my liver. Remember, what did I tell you a delusion is? A delusion is a false belief. The patient really have an alien growing in the liver? No, that's a delusion. Let's look at our other choices, guys. So B, I see my dead husband everywhere I go. That's a hallucination. Seeing something, hearing something that is not real. That's a hallucination. C, the IRS may audit my taxes. maybe the IRS might audit their taxes. So that's not a delusion. Okay, remember, a delusion is a false belief. Maybe IRS will do it. We don't know that, right? So that's not a delusion. And then we have choice D. I'm not going to eat my food. It smells like brimstone. I don't even know what brimstone is. I need to look that up. I have no clue what brimstone is. And anybody knows what that is, go ahead and leave it in the comment section for me. So I can't even say maybe it does smell like brimstone because I don't know what that is. But it's not a delusion, right? Because a delusion is a false belief, where hallucination is seeing something or hearing something that is not real, does not exist. So it's the senses experiencing something that does not exist. A client diagnosed with schizophrenia is slow to respond and appears to be listening to unseen others. Which medication should a nurse expect a physician to order to address this type of symptom? A, Haldol to address the negative symptoms. B, Klonopin to address the positive symptoms. C, Risperdal to address the positive symptoms. Or D, Clozaril to address the negative symptoms. And I'll give you a moment to think of your answer. And they gave us a couple clues in this question to cue us to the right answer, okay? So the correct answer is C, Risperdal to address positive symptoms. So first of all, Risperdal is an antipsychotic, right? Patient who's schizophrenia that's having these hallucinations, right? That's psychosis. So this is an antipsychotic that would be given. We would expect that. And let's keep going to address the positive symptoms. And this patient is definitely exhibiting positive symptoms. Let me see what it says. It says that they're slow to respond. They appear to be listening to unseen others. So guys, let me explain the difference between positive symptoms and negative symptoms. Positive symptoms are symptoms that the patient has that they should not have, such as seeing things that are not there, hearing things that are not there, having command hallucinations. Those are positive symptoms. Having patient experiencing things that they should not experience. Okay. Now, negative symptoms are the patient not having things that they should have, such as facial expression. Right. If the patient has a flat affect, that means that they have no kind of affect at all. If I'm sad, I'm showing I'm sad. If I'm happy, I smile. If I'm excited, I show I'm excited, right? But the patient with a flat affect, they don't have any of that. They don't have any of the symptoms that they should have. So that's a negative symptom. So a positive symptom is having something you shouldn't. And a negative symptom is not having something that you should. So this is the correct answer. C, we're going to give Risperdal, which is an antipsychotic. The patient obviously is psychotic at the moment, to address positive symptoms. And the patient's hearing voices. That's a positive symptom. Okay? And when I say psychotic, guys, psychotic in terms when we're speaking about mental illness, that means being out of touch with reality. Okay? Now let's look at our other choices. A, Haldol, that's also an antipsychotic, but look at the rest of the answer to address negative symptoms. The patient's not experiencing negative symptoms, they're experiencing positive symptoms, so that's why A is wrong. Choice B, Klonopin, which is a sedative, to address positive symptoms. Well, the thing is, the patient does have positive symptoms, but the first part of the answer was wrong. We don't expect a sedative, we expect an antipsychotic. Choice C, which was our right answer, and then we have choice D. Clozaril, which is an antipsychotic, we expect that to be given to address negative symptoms. Patient doesn't have negative symptoms. So that's why C is the correct answer, because both parts of that answer is correct. We expect an antipsychotic because this patient's out of touch with reality, and we know it's going to treat positive symptoms, which is what the patient is experiencing. A client is diagnosed with schizophrenia. A physician orders Haldol 50 milligrams twice a day, Cogentin 1 milligrams as needed, Ambien 10 milligrams at night. Which client behavior would warrant, wait, is my HS at night or after eating? Guys, I'm having a brain fart. I think it's at night. I got to go back on that one because I'm having a brain fart. All right, let's keep it moving though. Which client behavior would warrant the nurse to administer benztropine? A, tactile hallucination. B, tardive dyskinesia. C, restlessness and muscle rigidity. D, reports of hearing disturbing voices. And I'll give you a moment to think of your answer. All right, guys, so the correct answer is C, restlessness and muscle, oh gosh, I need my glasses. Restlessness and muscle rigidity. Okay, so Cogentin is an anticholinergic. I've talked to you guys about anticholinergics. You know, can't see, can't spit, can't pee, can't, right? But they also help with extrapyramidal symptoms, such as the restlessness and muscle rigidity. That's why that's the correct answer. Now let's look at our other choices, guys. We have A, tactile hallucinations. Patients having tactile hallucinations, they're going to need antipsychotics such as the Haldol, okay? So that's not the correct answer. B, tardive dyskinesia. Tardive dyskinesia would be because of antipsychotic medication. If patients been taking antipsychotics for a very long time, they can end up having tardive dyskinesia. Choice D, reports of hearing disturbing voices. That's, again, a hallucination, so they would need what? An antipsychotic such as Haldol. So the correct answer is restlessness and rigidity. That's choice C, because of what? That anticholinergic drug, the Cogentin. That actually helps with those types of extrapyramidal symptoms that the patient would be exhibiting. And I can't believe it, we're already down to our last question, but these are some great questions. So I'm going to make sure, let me see if I have enough. Yeah, I'll make sure I do have a part 2 for you guys, okay? So last question. The nurse is caring for a client who's experiencing a flat affect, paranoid delusions, anhedonia, anergia, neologisms, and echolalia. Which statement correctly differentiates the client's positive and negative symptoms of schizophrenia? Now, you guys all should get this right because I went in depth. I spent like 5 minutes explaining the difference between positive and negative symptoms. All right, so let's talk about this. A, paranoid delusions, anhedonia, and anergia are positive symptoms of schizophrenia. B, paranoid delusions, neologisms, and echolalia are positive symptoms of schizophrenia. C, paranoid delusions, anergia, and echolalia are negative symptoms of schizophrenia. Or D, paranoid delusions, flat affect, and anhedonia are negative symptoms of schizophrenia. And I'll give you a moment to think of your answer. Okay, guys, so the correct answer is B. Paranoid delusions, neologisms, and echolalia are positive symptoms of schizophrenia. These are all symptoms that the patient has, but they should not, right? So that is the correct answer. Now, let's go through the wrong choices. Choice A, where it says paranoid delusions, anhedonia, and anergia are positive symptoms of schizophrenia. Well, not all of them are positive symptoms. Guess what? Anhedonia and anergia are negative symptoms. These are symptoms that they should have that they don't. Choice C, paranoid delusions, anergia, and echolalia are negative symptoms of schizophrenia. Not all of them. Guess what? Paranoid delusions, echolalia, those two are positive symptoms. These are symptoms patient has that they should not. Choice D, paranoid delusions, flat affect, and anhedonia are negative symptoms of schizophrenia. Not all of them. Paranoid delusions are what? Positive symptoms. These are symptoms patient has that they should not. Okay? So that's why B is the correct answer. Guys, I hope this video brought clarification to you as far as psychotic disorders and schizophrenia. Now, I've got a good amount of more questions to cover on this. These are wonderful concepts, and I see these types of concepts pop up on tests over and over again, so I really want to make sure I cover it with you. There will be a part 2 coming, so watch out for that. Guys, I want to say thank you so much. Thank you so much. This morning I woke up and I finally reached 1,000 subscribers. I never thought it was going to happen, but I'm so excited. I'm so happy to know that I'm reaching so many students. So you guys leave me comments and I'm like near tears, because that's what my heart is. My heart is to make sure that students all over the country get that help, because I remember what it was like when I was a nursing student and I was trying to figure things out on my own, and it was just so stressful. So anything that I can do just to, reduce even just a little bit of stress in your life, it makes me happy. It makes me happy. And I want to thank you guys so much for subscribing. Thank you so much for sharing my videos on your social media, sharing it with your classmates. I really appreciate you guys. Please don't forget to go ahead, like and subscribe below. Press that red notification button so you know every time a new video is released. Don't forget to share my videos. Thank you so much, and I'll see you on my next video.